My name is Dr. Daniel Hoyle. I'm a senior lecturer in Therapeutics and Pharmacy Practice in the School of Pharmacy and Pharmacology at the University of Tasmania. I do lecturing across a broad range of subjects in pharmacy and medicine degrees, but I also do a lot of research around de-prescribing, particularly in older adults with dementia. I completed a Bachelor of Pharmacy in 2012. While completing my Bachelor of Pharmacy, I undertook an honours research piece as well, where we investigated the penetration of certain drug molecules into the brain of Alzheimer's mouse models. This really, sparked my interest in dementia at that point. Following my undergraduate studies, I moved on to an internship as a pharmacist in the North West Regional Hospital in the north of Tasmania. During that time, I saw a lot of older patients who were taking lots of different medications, and I noticed that there's an opportunity there for patients to be potentially taking less medications, which may have reduced their risk of certain adverse effects. In 2013, I was offered the opportunity to undertake a PhD at the University of Tasmania, which investigated the clinical and economic outcomes associated with antipsychotic and benzodiazepine dose reduction within a multifaceted implementation called the Reducing Use of Sedatives project, or REDUCE project for short. That was implemented across 150 aged care facilities across Australia. I took a lectureship in 2016 and have been working as a full-time lecturer since then, and completed my PhD in 2020. In 2022, I was fortunate enough to be awarded a place on the US De-prescribing Research Network Investigator Intensive Program, which has expanded my research in the de-prescribing space since then. In 2024, I was fortunate enough to be funded by the Royal Hobart Hospital Research Foundation to implement and evaluate an antipsychotic stewardship program to improve the use of antipsychotic medications for people or older people using these medications for dementia, and also those using it for delirium. The project's called the Geriatric Antipsychotic Stewardship Program, or GAPS for short. It's a stewardship program aimed at improving the use of antipsychotics within the Royal Hobart Hospital, particularly focused on older people in the medical wards or on the older persons unit. Research has indicated there's high levels of adverse effects associated with these medications in older people, and where possible we should try and use these medications judiciously. This project aims to ensure that these medications are being used appropriately at discharge from the hospital, but also to improve the communication to the GPs to ensure that there is a plan to reduce these medications over time. I'm really passionate about de-prescribing, particularly in older people, because of the great people I work with from lots of different disciplines that are really passionate about their work because they are having a big impact for this cohort in society. I'm kept really busy outside of the work environment. I've got twin toddlers, which keep me on my toes a lot. They're balls of energy. Aside from that, I try and get to the gym regularly, which is a lot of fun.